All right. Well, it is 7, so I will just give Kevin a quick introduction just to keep us on track. And I'll thank you guys for joining us on such a beautiful evening. But Kevin does a great job with his workshop. We've got some repeat attenders. I was just saying that kind of attests to what a good job Kevin does with presenting the information and just being an engaging speaker. We appreciate that too. So I think you'll get a lot out of it this evening. Kevin's a wealth of information. He's got over 30 years of experience, a very diverse client base. In addition to companies like us, he has consulted with retired professional athletes, celebrities, business leaders. So he just has just all kinds of experience and knowledge. And I know whenever we have questions come up, I have learned not to advise on Medicare because there's so many different things that can trip you up. And something that seems logical, and Kevin will get into some of these things tonight, and it just seems like it can be a no-brainer, but there's these little caveats and you would never know that it's going to be a problem for you. So I just encourage you to. Kevin does make himself available one-on-one for all of us here at ESSA Health and all of us here at Navis. We both have a relationship with Marsh McLennan Agency, who Kevin is joining us through. So anyone can feel free to consult with Kevin one-on-one. I'll include the information. We'll send out a survey after the presentation this evening if you don't mind giving us some feedback, and it'll have all Kevin's contact information. It'll have the handouts that he's talking about as well. So we would appreciate that, but that'll give you his contact information. Please feel free anytime you're getting close to Medicare and signing up, or maybe different things are coming up with COBRA and everything, and you're close to Medicare eligibility, give Kevin a call to talk through your situation, just so you don't make one of those mistakes that no one would ever really think to know about. So without further ado, I'll turn it over to Kevin and let him get started. And thank you so much, Kevin, for making the time for us tonight and being here to help us.
Oh, you bet, Joyce. Thank you so much. A couple quick notes, folks. One is I do this on purpose. When I'm working with HR folks, I sort of do this. I tell them, keep Medicare at arm's length, and there's a reason for that. It's an individual insurance product program, kind of like your car insurance. So your employer is offering some great resources, but beyond that, it's up to you. And that's why I'm available. And one of the things that I love to know, you see all the PR fluff on the screen. I've done this forever, folks. I am not a salary or a commission salesperson. I am a salaried risk manager. I'm here to help you guys. So here to help. I place coverage, I broker coverage, but what I'm really here to do is keep you guys on the right track with great coverage. Hang loose with your questions tonight. We'll have a Q&A session at the end. And I do note I always hang around for a few minutes after these presentations. We'll disconnect, but I'll hang loose. My contact info will be the last screen. So you're welcome to reach out today, tomorrow, next week, next month, whenever. The theme tonight really is we're going to establish that Medicare is great coverage when you do it right. I think some of you folks know that. We want to kind of take down that wall for you. It's great coverage when you do it right. What we also want to do here is remind you that timing is everything. So I'm going to say this several times, folks. I'd rather you come to me 2 years too early than 2 minutes too late, because some things are undoable in Medicare. We want to get it right. On that subject, all that stuff you guys are getting in the mail, if you're getting a little gray like yours truly, you're getting stuff in the mail. You're getting emails, you're getting phone calls, all that stuff. Ignore it. You're going to know what's official from Social Security, from Medicare, Department of Health and Human Services. The rest of the stuff, frankly, folks, it's birdcage liner or recycle bin filler. So don't regard it. Call me when you need help. What we're going to cover tonight, we're going to tackle original Medicare. You're going to hear me use that phrase quite a few times. It's amazing coverage. We're going to talk about adding in a Medigap coverage with that. We're also going to talk about Medicare Advantage, and this is a space where I think you guys know Medicare Advantage better than most for obvious reasons. You do it right, it can be fantastic coverage as well. You do it wrong, ho, ho, ho. So we're going to talk a good bit about that tonight as well. And then the greatest improvement in Part D, prescription drug coverage, happened last year. We're going to talk about that. I'm going to give you some good news on that as well. So digging into this, the folks that have been here before for me, don't put your hand up. But anybody want to take a guess, you can unmute. I know this is sort of aimed for in-person crowds, but I do this to offer some perspective and maybe loosen up the crowd a little bit. Anybody want to guess who the first Medicare enrollees were? There were two. They enrolled at the same time. Joyce, no cheating. You know this one. Harry and Bess Truman, folks. You cannot read that card, but it says 7/1, July 1, 1966. So we're 60 years into Medicare now. This is pretty amazing to think. It's also worth noting, yours truly, the nerd that I am, I'm on vacation in Austin, Texas. I have to pull my poor wife to the LBJ Presidential Museum to take a picture of Medicare cards. But know that these two were the first. We have a lot more now. I love this. I ask this question all the time. I asked one of our interns in the hallway last summer, and he goes, that's got to be 1 million people. Medicare's a big program. I know that. It's got to be 1 million people. It's more than that in Missouri, folks. 70 million Americans are on Medicare. That's 1 out of 5 of us. Excuse my allergies. The reason I bring this up is perspective. The world's a little goofy right now. We know that. The federal budget always has budget frictions and challenges. Medicare's not going anywhere. Things change. They always do. We keep an eye on them. We're good advocates for our clients. But no one is going to step in front. I chuckle a little bit. No one is going to step in front of a bus filled with 70 million active voters and mess around with Medicare. It's not going anywhere. It's great coverage. So what we're going to land on today is Medicare. We're going to stay focused on that. You're going to see references throughout my slide deck to SSA, Social Security Administration, but we're only addressing SSA as it intersects with Medicare. Social Security Administration does the billing and the enrollment for Medicare. Beyond that, it's all Medicare. You guys know what the program is and who it's for. You're 65-ish. You start looking at this. 64, you start looking at it. But I always suggest, please have your friends, your family, your neighbors, your coworkers call. If they're under 65 and they have a health issue, if they have kidney disease, ESRD, if they have ALS, Lou Gehrig's disease, or the big one, if they've been legally disabled by Social Security for 2 years, they're going to get a Medicare ID card in the mail. And the challenge is they may need it and not know it. They may have no idea what that card's for. Please have them reach out to me, folks. I'm glad to help them. That's a real trouble spot. So know that we're here to help with resources. And SSA, of course, is our go-to for all things Medicare. Applying for Medicare, you guys know this part already. It's the time around your birthday, your 65th birthday. And most of us aren't taking Social Security yet, so we have to opt into Medicare if we're taking it. So that's a reminder, folks. It's mostly opt-in for Medicare. You have to do that on the SSA website. And the SSA website, the Social Security Administration website, is a beautiful website. You see the address on the screen there. It's ssa.gov, not .com, .gov. And everybody on the Zoom tonight, on the meeting tonight, please go to that website while it's fresh in your mind sometime in the next few days. Log in, set up a password. It can take a few minutes. You have to verify your identity. Uncle Sam wants to know that you are the person connected to that website. And once you're in there, set up your password, protect your information, review your information. It's your real estate, folks. You need to protect it. There's also some great information there. The old paper notices we used to get in the mail, they don't send those out anymore. So if you want to know what you're going to get for Social Security or enroll in Medicare, it's right there on the Social Security admin website. And again, you're likely opting into that when the time's right, not waiting for Uncle Sam to send you an ID card if you've enrolled in Social Security retirement. Here are the basics. You're going to hear me reference original Medicare quite a bit tonight, parts A and B. C was added in 2006. D was added in 2006. The reason for A and B being separate, this is really old. This is 60-year-old stuff, 65-year-old stuff, really. Back in the day, employers often offered hospital coverage. So when Medicare built these products, they built hospital coverage to be the free part. And what I mean by free is you've paid for it for 40 years. It's taken out of your payroll taxes. You can see that on the SSA website as well, how much you and your employer have paid for both Social Security, Medicare, and taxes. You're getting Part A for that premium free. Back in the day, if you wanted medical insurance, that was often something you bought on your own through companies like Blue Cross. Go down to the Allstate agent in the Sears store and buy a Blue Cross policy for your family. They were separate, so they were funded separately, designed separately all those years ago. Now we know all these insurers, United Healthcare, Anthem, Blue Cross, Blue Shield, they're these big behemoths now, but Medicare remains what it is because of funding. A is separate from B, hospital and medical. Adding in Part C, that's Medicare Advantage or Medicare Replacement. That was an innovation that came along just a little over 20 years ago, and we added drug coverage at the same time. So we'll go a little deeper for a moment. Part A, I referenced is the premium-free part. If you've worked 40 quarters, 10 years, or you're married to someone who's worked 40 quarters, 10 years, you're fine. You're covered. I had a client I talked to yesterday. He is a British expat. He's going to go on Medicare. He hasn't quite worked his 40 quarters. He's probably going to have a couple years to go. So he's going to have to pay for Part A for a little while. You can see on the screen what that cost is. Not cheap for him. But once he hits his 10 years, his 40 quarters, he'll be fine. Note, always note this, folks. Anytime you see on my slide deck, call SSA or call a number, that really should read as call Kevin. When you need help, give me a call. If there's a resource, if there's information, if there's a web link, if there's perspective, I'll offer that. If you need to go to SSA, I have local phone numbers. We'll get you to the right person at the right time. And if you go in with the right perspective and you know what to ask, you're often getting better answers. So when you need help, reach out to me on that. And here's your big one. Hospital coverage, very limited. It's hospital coverage, folks. I say this a lot. I really emphasize because I get some phone calls on this. SNF care, skilled nursing facility, not covered by Medicare. There's an asterisk there for a reason. If you have been in the hospital, 3 midnights is the famous phrase for Medicare. If you need skilled rehabilitative care, Medicare will provide it. They'll pay for up to 100 days. And a great example, you've had a stroke. You've been in the hospital. You need OT, PT, get you back on your feet. They will provide for up to 100 days skilled rehabilitative care. But the stuff we all dread, frontal temporal dementia, Alzheimer's, those god-awful things, not covered by Medicare. That's a nursing home issue that's not solved with Medicare. It's more a societal issue than an insurance issue. Other resources out there, maybe I can make some suggestions, but know that Medicare is about healthcare, not about skilled nursing. The other half of original Medicare, we have Part A hospital, Part B medical. And I really drill down on enrollment here, folks, because sometimes we're taking Part A, because it doesn't cost us anything, before we take Part B. And here are your EPs, your enrollment periods. These are 2 of the 3 we're going to land on tonight. There's the initial enrollment period. That's the window around your 65th birthday. It's the 90 days prior. And note, folks, if you enroll in those 90 days, you go enroll in Medicare on the Social Security website. It starts at the beginning of the month in which you turn 65 for most folks. So if your birthday is today and you enrolled in Medicare in March, Medicare actually started April 1 for you. If you enroll in the month of, it's the end of the month, and there's a 3-month window after that. You still have your IEP, initial enrollment period. Here's the big one. If you were an early comer to the slide presentation tonight, you might have heard Joyce and I reference just briefly COBRA and the complications. Folks, I am not kidding. I always tell my note takers, write down COBRA bad, call Kevin. And what I mean by that is COBRA is a problem. So COBRA, y'all know what it is. COBRA is an extension of your current coverage past employment. You can keep your health plan. In most cases, up to 18 months, some circumstances, maybe a little longer. You pay the whole cost. You pay an admin fee, a couple percent. What happens on occasion is you've got everything coming at you for retirement. And you figure, and maybe retirement, maybe the timeline was shorter than you planned. You're heading out the door, you figure, I'll take COBRA. Whatever, I'll deal with this. I've got my life ahead of me. I've got things happening. I'll take COBRA. I'll give those forms back to Joyce. I'll hang on to it for a few months, and then I'll come back to Medicare. Folks, that's a problem for 2 reasons. The first reason is Medicare under federal law is primary to COBRA. Your COBRA coverage, it's not actively at work coverage. So Uncle Sam says that is secondary to Medicare. So you go get a big claim, and some of the folks on here that may be on the billing side of things may already understand this. It's called estimating claims. That insurer, that COBRA insurer of yours, will pay that claim as if you have Medicare, even if you don't. It's tough. And then talk about piling on. You now realize you have all these bills coming in. You call some poor schmuck like me, and you want to go get Medicare. And I have to tell you, and I'm going to send you to Social Security, and they're going to tell you, you might be too late for your enrollment period. You're past your IEP. There are no special enrollment periods. That's coming in a couple slides. You're going to have to wait. And it's the GEP, the general enrollment period you're waiting for. Folks, today, if you had to wait for the GEP, it's next January when you enroll, and coverage starts February 1. So it could be a long, nightmarish run if you get this timing wrong. And I say that to scare you. Ignore the sales pitches. They want you to sign up for something, but they don't tell you what. folks, call me. 2 years too early, better than 2 minutes too late.
I just want to jump in, Kevin, really quick and add to
Please.
that. We're seeing more of that in the benefits world with the newsletters and things with a lot of the companies, like we were talking at the beginning while we were waiting for people to join. There's a lot of reductions in force happening, unfortunately, today. And with that happening, sometimes employers are offering to subsidize COBRA and like give people so many months for free, which is one of those things that sounds like a no-brainer. Why wouldn't you take the free coverage? But then people are finding out, like the first point of that Kevin made, they go for maybe a colonoscopy or something like that. And then the COBRA doesn't pay. It pays as if it's secondary, even if they're not enrolled in Medicare, which is something that just seems crazy. But you're seeing more stories about that popping up. And then the second part of that too, like Kevin said, could be a double whammy where then you're also looking at not being able to enroll in Medicare because you're past deadline. So I won't go past that, but just wanted to reinforce that that's something that we're really seeing a lot too. So definitely appreciate Kevin bringing those things out.
You bet, Joyce. Thanks on that great emphasis there. Folks, we have to be careful on this stuff. That's why I'm saying call me, text me, email me, whatever you need. Here's the other one that gets a lot of interest. You guys have great coverage with ESSA, with Navis. You don't have to do a thing with Medicare at 65 if you're still actively at work. Here's the rule. If you're actively at work and you're Medicare eligible, or you're married to someone and you're on their plan and they're actively at work, you can skip Medicare for the time being if you want. No pressure. All the sales pitches, gotta sign up, must sign up, big red letters, must enroll, penalties, problems, waiting periods. It doesn't apply. The big get out of jail card is a form that Joyce completes in her sleep. She's done so many of them. It's a form when you're 68, 70, 75, you finally go move to Medicare. It just confirms you've had that employer coverage. It's your get out of jail free card. It waives that form, allows SSA to waive penalties. You can start whenever you want. No penalty, no problem, folks. So again, you have great coverage. You don't have to do a thing with Medicare. You may want to. Medicare is great coverage. In some cases, it's cost beneficial, especially these days. I know you guys are better than most, but some employers don't contribute anything for spouses. Maybe your spouse is turning 65. You want to do that math. If you ever want to do a quick cost benefit analysis, chat about this, please reach out to me. We can do that in about 5 or 10 minutes and see if remaining on employer coverage is better than taking Medicare or vice versa. And again, you guys have great coverage. I've seen it where employer coverage degrades to the point where BJC is not in the network or SSM's excluded from the network. Certain medicines, certain oncologists aren't in the networks. You may want to consider Medicare, but know that there's no pressure here. This is your pressure relief valve. You can wait. So Part B coverage, A is hospital, B is medical. I love to call it labs and doctors. That's really what it is. You see a partial list of what it covers. The big ones over the years, though, really it's oncology. There's some amazing stuff in oncology that Medicare is paying for. Opdivo and Keytruda infusions. You've seen the commercials. I saw them recently on a St. Louis City soccer club TV show. There were commercials for Opdivo, and I always key in on that because I had a client a couple years ago who had 30 of those Opdivo infusions, and the retail cost, I don't know what it was adjusted to, but they're $40,000 each. Medicare picks those up, so pretty amazing stuff. Part B has a cost, of course. A, I referenced, you've been paying for it in your payroll taxes. This is where we start doing the equation, folks. No matter what path you choose, you're going to have to pay for Part B. For most of us, for 93% of us, it's the number you see on the screen there, the headline figure of $202.90 per person per month. That does go up a bit every year. Biggest increase ever last year. It was $187 last year. Big jump. But that's for 93% of us. If, however, you're on the higher income side of things, you see a number on the screen, $689.90. There are actually 6 categories of means tested Part B premiums. You could fall in one of those higher categories based on your income. They're always looking at a 2-year-old tax form. No one is going to weep. I love to joke about this. If you're in the $689.90 category, you're single, you're earning over $500,000 a year, or you're filing jointly, you're over $750,000. So it's not a big pressure on your budget, but it's worth the cost benefit analysis, folks. Again, comparing to SE Health, comparing to whatever employer plan, we have to look at the stuff. We also have to budget for it. One other quick note, if you're in a higher income category and you retire and your income is dropping soon after retirement, you can frequently go back to Social Security and get them to adjust that Part B premium down right away. They normally do it every fall in November, but you can do that right away. If you ever need help on that, please reach out. I'm not going to go deep here, but sometimes we can do that. Excuse my allergies. And that's important as far as your budget, because if you get that wrong and you find out years down the road you could have been in a lower Part B category, you can't go back and get a refund. So final note on this slide, the last line there, the monthly payments, that does come out of your Social Security check, Part B, if you're getting Social Security. And if you're not, if you're taking Medicare before Social Security, we all know the joke, Uncle Sam knows how to get paid. You're going to get a quarterly invoice. If you would prefer, go to Medicare.gov. I'll show you how to do it when you need. You can set up Easy Pay right there. Have them take it out of a bank account monthly going forward. Also pay with a credit card these days. You can't do debit from credit card. They won't allow that, but you can pay it quarterly. I have a lot of clients that do that for credit card points and miles. So again, pretty easy process. Here's the big one, Original Medicare. Any willing provider program. All of our administrators and billing folks know this one well. 98% in Original Medicare. Pluses and minuses to that. There's no quality control. Pretty much everybody takes it. But the good news is you can go to National Centers of Excellence and organ donation, organ transplant centers. So it's a pretty darn good network. I always love talking about that network. So we're going to go a little deeper in a moment. Quick reminder, we talked about Original Medicare, A and B. We're going to go into details here in a couple slides. We're going to talk about Medigap policies that go with Original Medicare. We're going to talk about Medicare Advantage. And we're gonna really talk about the good news in Part D drug coverage as well. So your Original Medicare, your A and B, details. Deductibles on the screen for hospital Part A and medical Part B. Those do go up every year, folks. That Part B deductible last year was $267, I think. The year before it was $240. The big one that we miss, we can handle those deductibles. The big one we miss is the coinsurance on medical services, Part B services. That's big, folks. I referenced Opdivo infusions earlier, $40,000 each. Medicare only pays 80% of that bill. So again, I don't know what the adjusted cost is, but if you have 30 of those or 40 of those, it's a big bill. So there are several ways that you can cover the rest of that. The first one is the old-fashioned one. We know this one. It's Medigap. I love Medigap. It's very straightforward. You're going to pay a premium for an insurance policy. Tons of companies, you know the names, United Healthcare and Anthem Blue Cross and Cigna, Transamerica, Mutual of Omaha, all these good insurers, a few maybe not so great, but they offer Medigap policies. And the secret to Medigap policies is Uncle Sam wrote the rules on them. So if you choose a plan A, or Plan G, or Plan N, whatever you choose, Uncle Sam wrote the rules. So Plan G with Anthem Blue Cross is the same as a Plan G with Mutual of Omaha and United Healthcare. The difference, though, and this is where a broker earns his commissions, folks. I am a broker. I love to place coverage, but a good broker, just like your car insurance, is going to go find that insurer that's right for you. Good competitive premiums, that's the obvious one, but there's some sort of intangibles there. The quality of the insurer. Do providers gasp when you come in with that Medigap card because there's such pain in the rear end to pay? Are there other issues? Do they have claims and billing issues? Do they use chatbots and overseas call centers? Are there problems beyond just the premium? Your broker can find the right carrier for you and also help you find the right plan. I'm not going deep here. I can't. But Plan G is the one that we see a lot these days in the Medigap space. And Plan G is very straightforward. You're paying, call it $200 a month if you're a 65-year-old male here in St. Louis County. And that Plan G is going to cover everything after Medicare. Medicare has to pay first. You go to a Medicare doctor, but Plan G pays everything after Medicare except your annual Part B deductible. And that this year, folks, $283. My great story, my client 2 years ago with a really tough to treat cancer, lung cancer, non-smoker lung cancer. He started at Siteman, found a clinical trial, went down to MD Anderson. Everybody took Medicare. His Plan G paid everything after Medicare. He met his $240 deductible 2 years ago. That's all he paid. And the bills, I mean, we ran out of fingers and toes to do the counting, but it was well over $2 million retail. It was massive. So this is a great way to transfer that risk. There is a cost to it. And there are different rules in every state. And for my folks that are out of state watching this, know that I work in Missouri and Illinois, but I have resources all over the United States. I love to joke that I have a Kevin in every market, but some of them are probably a little better looking than me. So I'll get you somebody in every market. Anywhere you're at, we'll vet them out. They can help you with this stuff. So don't go direct to these insurers. Don't try and do it on your own. It's a pretty straightforward process, but we want to get it right. Medigap works because of timing. Timing is everything. When you go enroll in Medicare Part B, the medical part that you pay for, maybe you're 68, maybe you're 65 and in your initial enrollment period, maybe you're 80 when you finally go take Medicare, but you're going to take that Medigap policy at the same time, so they can't turn you down. It's called guarantee issue. After that, the rules get complicated. You might get locked out of the market. So again, reach out to me 2 years too early. Reach out to me anytime before you need it so we can plan this out for you. So that's our first path, the old-fashioned path that I love. Pay your Part B premium. You have original Medicare, you can go darn near anywhere. Pay that premium for the Medigap policy, which is an insurance plan. It pays after Medicare. It pays just about everything after Medicare, depending on the plan you're choosing. There is a cost to that, however. There's that premium for that Medigap. That's also a big network that you may or may not need. So the alternative is Medicare Advantage. This is a program that George W. and the Congress passed in 2003. And the intention, and it's good intention, and sometimes it works, the intention is to keep folks healthy. They pay a capitation fee. They're going to, you go enroll in that Medicare Advantage plan, and they're replacing Medicare. And what they do is they cover everything Medicare does, and Medicare pays that insurance plan a fee every month, fixed fee. And if that insurer keeps you healthy, they win. And that's the key to this stuff. And that's why you have to stay in network, folks. That's quality control. You're going to avoid the HMOs. I'm not a fan of HMOs. You guys remember that acronym from the 90s. There's a lot of interference there, from referrals to prior authorization to God knows what. So the good ones are often PPOs. Good in-network coverage. Maybe you can go a little wider when you need experts. And again, here it is. A and B services are covered by that Medicare Advantage plan. And the Advantage to Advantage, you've seen the envelopes. There are good ones and bad ones. That premium is far lower in most cases than a Medigap policy. Anywhere from $0. Some of the good ones are nothing. They run up to about $70 a month, depending on the plan. And depending on the program, the plan itself. You have to look in that plan, folks. And this is that place. I've hinted that the network is important. You know that. You're going to check your network. But you have to know the plan itself, because there are deductibles, copays, and coinsurance. This isn't a good old-fashioned Medigap where they're paying pretty much everything after Medicare. There's some cost share for you. Go to the doc. What do you pay? Go to the ER. Go in the hospital. There's some copay or some deductible that you have to meet. But you're protected by an out-of-pocket maximum. Again, depending on the plan, $2,000 to $9,000. And it's not linear, folks. Sometimes the zero plans have a lower out-of-pocket than some of the plans with a cost. It has to do with network and quality of coverage. And the big one, we're sort of talking between the lines here for a moment. Look at the star rating. CMS, the Medicare regulators, have a star rating for drug plans, for Medicare Advantage plans. And that MA plan, that Medicare Advantage plan, it's a 1 to 5 star rating. The acceptable ones are 3 stars, 3.5 stars. Start getting better at 4 stars. 5 stars, ho-ho. We know the one, folks. Everybody on here knows that one plan here in St. Louis that has 5 stars, because you guys work for that company. We do have to look at that. And you can look on the Medicare website. If you need help, reach out to me. I can show you the page that outlines the criteria that determines that star rating. It really is important. And again, if you're working with a broker, that broker can get you to a good plan, good network, help you to understand the out-of-pocket exposures, and look at that star rating and get you into one that works well for you. Because the last line on this page is the important one, folks. First year is a trial period. There's kind of a warning built into that. The Medicare Advantage program, when you're in it, you're in it. Unless you move or go into a skilled nursing facility for the rest of your life, you're in the Medicare Advantage program after that first year. If you want to get out of it, you have to answer medical questions to get that Medigap policy. So when we pursue this path, we're doing it because we like the plan. The plan may have a low premium, but know that we are stuck in that program in most cases forever. So be careful. Know before you go. And the one that I've put in bold here, may get extra benefits. Oh, folks, we know better. I have a client. He's a retired tire dealer. I love him, Morty. He says, "So you're telling me the stuff they throw in the dental and the vision, it's like white walls and undercoating." And Morty's right. If you think about it, it's sort of something that looks pretty good, but there's not a lot of value there. Maybe there's something there. You get some cleanings at the dentist. You get a pair of eyeglasses. That's pretty cool. Don't choose your plan based on that stuff. It's the star rating. It's the quality of the plan and the network. And it's the out-of-pocket exposure. So we do have to be careful. And again, work with a broker. Know the quality of that plan. Because if we're just scanning this stuff on the internet or using Chat GPT or relying on these god-awful call centers, that's where the problems really develop. Eligibility, I always restate this. You have to live in the planned service area. That's obvious, but it's not so obvious. You get deep in these things and you forget to check the network. Who's your favorite hospital? What's your favorite hospital? Who's your doctor? Make certain these folks are covered. And double check the specialist networks. What happens if you get that awful diagnosis? Can you go to a National Center of Excellence? Do you have a cancer center? Is it a decent plan? The good ones, no issue, no problem there. The bad ones, not so much. So proceed carefully. And when you need resources, let me know. We're going to skip this one. And here's what drove originally. I always love to bring this up because Medicare Advantage does save the government, in most cases, some dollars versus original Medicare. And this is why, folks, there's always friction on the federal government with that budget. That is $1.1 trillion with a T. I don't have enough fingers and toes to tell you how many zeros that is. Total Department of Health and Human Services budget, RFK Jr.'s budget, $1.5 trillion. That's a quarter of the federal budget, folks. So again, there are always pressures on Medicare to innovate, to save some dollars. But don't let that be your problem. You've paid your payroll taxes. You've paid your taxes. You're paying for coverage. Choose the plan that works for you. Cost and quality are both important. So we'll pause. Quick restate. Original Medicare and a Medigap policy or Medicare Advantage. You're choosing a path. You may look to the Medigap policy, lower out of pocket, higher premium, bigger network, just about everyone nationally. Or save some dollars with Medicare Advantage. Know you have a good local network and understand your out-of-pocket maximum. In both cases, folks, you have to have drug coverage, even if you're taking no medicines. There are Medicare Advantage plans out there that do not include drug coverage. So when you're choosing a plan, please check carefully. And drug coverage has gotten infinitely better. You're seeing the big one on the screen there, folks. The donut hole is gone. Thank goodness. No more convoluted donut hole. No more problems with the donut hole. It's gone. And we're going to touch on eligibility and enrollment just for a moment. We're back to those darn EPs, enrollment periods. You have your initial enrollment period. When you go take Medicare Part B and you enroll in that Medigap policy, hang on, folks. Joys of working from home. Bear with me. There's that initial enrollment period. You have your original Medicare and your Medigap, and you're going to take a drug plan at the same time. I'll explain why as we go. And then know that you can change that darn drug plan every year on Medigap if you have original Medicare with a Medigap, and you should check every year. These insurers are not always putting your interests at the forefront of their considerations. What we see historically is the premiums go up, the quality of the plan goes down once they win a lot of market share. And my offer, folks, take me up on it. We have a great team of specialists available. We can run reports. There is a fantastic tool on the Medicare website. All I need, very straightforward, your zip code, your list of meds, the name, dosage frequency, and your pharmacy. We can run reports, tell you which drug plan, how much you're going to pay for the drug plan, and what you're going to pay for your drug costs. And then every fall, same thing, and you could switch. And note, if you're coming into this late, 68, 70 years old, whatever, you retire late, you have a special enrollment period to take that drug coverage as well. If you're coming off SE or Navis's employer group plan, you're going to be fine to take that coverage. Late enrollment, I'm not going deep here except to warn my guys. Gentlemen, you take no medicines. Don't skip the drug plan, please. I see this too much. Guys are guilty of this. You figure, well, I'm fine. I'll wait. The problem with that, right now, you go enroll in a Medigap or a Medicare Advantage plan for May 1. You don't have drug coverage. Something awful happens June, July, August, and you get prescribed something very expensive. You can't get a drug plan, folks, until open enrollment. So there could be a big exposure there. I know right now in the individual market, if you're doing Medigap and pairing that with a drug plan, the least expensive Part D plan out there, $9.60 a month. It's a good plan. So don't skimp. Don't skip. Same with Medicare Advantage. The good MA plans, you're not paying more for that plan if drugs are baked into it. So here's the one that I love. I hinted at earlier. I explained the greatest improvement in Medicare in more than 20 years. The end of the donut hole and something called a troop cap. Troop is for true out of pocket. And that cap was $2,000 last year, $2,100 this year. It'll go up a little next year. We don't know what yet. Uncle Sam hasn't told us. But that's your worst case scenario, folks. As long as the meds are covered, you go fill that prescription. You get some god-awful expensive medicines, stuff you see advertised on city soccer games and Cardinal games. If you spend $2,100 on an MA plan or a Part D plan, standalone, you're done for the year, folks. Thereafter, Medicare and the drug plan pay 100% of your drug costs. Medicine's not covered, you can substitute, just like your employer plan, or do a medical necessity appeal. And then if it's covered, you're going to pay whatever up to that cap, and then you're done. I ran a report this morning, a medicine. I reference this medicine a lot. I see it more than I ever thought I would. It's called tolvaptan. The doctors on this team's meeting immediately understand tolvaptan. It has something to do with sodium levels in your heart. You have to take it if you're taking it. There's no opt out. Even though it's generic, tolvaptan is $12,000 a month, folks, on these Part D plans as of last year, subject to that troop cap. $2,100, you're done. And there's a beautiful innovation that goes with that. There's a premium payment program. You know, at the start of the year, you're going to hit that $2,100. Tell the insurance company there's a form to complete. I'll help you with it. They will pay it for you at the pharmacy, and then they'll cut that $2,100 up into 12 equal parts, and you'll pay it as part of your premium every month. That's part of those reports we can run. We can tell you if you're going to hit it and how you can divide that up and what you're really going to pay. So pretty cool program, big improvement. No one wants to spend $2,100 on prescription drugs, but it is a heck of a lot better than the old program, folks. I had folks, for reference, I had a multiple sclerosis client under the old Part D program. She was paying close to $30,000 a year, pulling that out of a 401k. God bless her. She passed a couple years ago. If she were still with us, this would have been an amazing thing for her. $2,100 and you're done. Extra help. Program's still around. It's teetering. It may go away, but in the moment, low income, few to no assets. There's a program through Social Security. They'll pay the premium for the drug plan, and they will pay for your prescription drug co-pays. It's a pretty cool program. If you ever need help, I can send you a link. If you have somebody that's outlived their Social Security check, an auntie, a neighbor, let me know. So we're going to skip ahead. We don't need that. And here's your Call Kevin page if you need help. I'm going to note that 1-800 Medicare number is lights out fantastic. They're so good at what they do, but there is a long hold time there. If you need some help, call me. Again, we'll talk perspective. All those .govs and all the references you see on the screen there, I can provide those for you. I can email them over. Even that massive monster Medicare and You handbook, 160 some pages, they mail out to 70 million people. I have an electronic version. You can go in there and click on the table of contents and hit a page. It'll take you right to it. It's pretty cool. And what we'll often do is we'll tell you which page, what you're looking for, and I can guide you to that page. You can click right to it. We always show our work on that when you need help. So again, with resources, you can always reach out to us. If you've ever been on the Medicare website, folks, you already know it's kind of a rabbit hole. It's pretty deep, pretty complicated. What you need, I already know where it's at. So call me, email me, we can help. So quick summary, and then we'll hang around for Q&A. What we covered today, pretty basic, pretty high level. We talked about original Medicare, hospital and medical coverage. You're going to pay for Part B, $202.90 bare minimum. And that's going to give you a card that pays 80% of the bill after your deductibles. And it's going to give you access to 98% of the providers in the U.S. If you want to keep that, add a Medigap or Medicare supplement policy on top of it. pay a premium for that insurance plan, and know that you're going to have very little out of pocket and very little barrier between you and high quality health care. The other side of that, the flip side, is Medicare Advantage. You want to save some premium versus that Medigap policy? Enroll in Medicare Advantage. You're replacing Medicare. You're still going to pay your Part B premium, the $202.90 a month or more, but it's often a lower premium. In exchange, you're going to have a narrow network. Some are better than others. You're going to have an out-of-pocket maximum. You're going to know that before you go because you're going to work with a good broker. You're going to check the star rating for that plan, and you're going to know if it's a high-quality plan. And in both cases, you're going to have drug coverage. Please don't go without drug coverage. And know that your worst ever year on prescription drug coverage, $2,100. And frankly, folks, 98, 99% of prescription drug enrollees never get anywhere close to that true out-of-pocket cap. I had a client a few days ago. It was really memorable. I want to say it was 6 or 7 prescription drugs she takes, all $0 copays because they're generics. Blood pressure, levothyroxine, and statin, and a couple other medicines. She wasn't going to pay a darn thing for them. So pretty cool program when you do it right. And when you need help, we can help with that. It depends on the Medigap policy, but most Medigap policies pay that hospital deductible. That's a $1,700 per occurrence deductible if you go in the hospital. So most Medigaps do pay that, and they do provide additional hospitalization. That Medigap policy, or Medicare, has a limit. Excuse my allergies. Has to do with timing, but there's a limit of about 9 months lifetime for hospitalization with Medicare. That Medigap policy and Medicare Advantage as well adds another year of hospitalization on top of that. Medicare actually pays 80% of the bill for Part B services. Your Medigap policy is often picking up that other 20%, depending on the plan. But Plan G is a great example. That Plan G does pick up the 20% once you've met your annual Part B deductible. And this is that point where steam comes out of your ears. And what I suggest is this is where we sit down, or you sit down with a broker and they open up the guide and we show you each plan that's available and talk you through specifics for each plan. That helps you to make that decision. And it's a lot, and this is why we plan ahead. And my late father was a naval aviator. He had TRICARE for Life, TCL as well. I don't know much about it, and there's a reason for that. It is so darn good, people don't come to me. If you have TRICARE for Life, you go get your A and B. If you ever need help, by the way, enrolling in A and B, give me a call. I'll talk you through the enrollment. But once you have A and B and TCL TRICARE for Life, you're set. It's great coverage. Oh, great question. That TRICARE for Life backstops Medicare. You don't need anything else. You got it. That's exactly right.
Thank you.
Absolutely.
We do have a question in the chat, Kevin. What is the best way to schedule time with you?
Reach out any darn way you want, folks. Janet Klein, she's one of my client managers. I love to jokingly call her my calendar boss. You can reach out to me or Janet anytime you need, and we can always set up Zoom and Teams in person. I'll come see you, or you can come by the office. We can do whatever you need. We're glad to help. And this is that reminder. I say it to my young team all the time. There are no emergencies in what we do because we're all going to plan ahead. And that's what I love. I love my planners. Come on in. We'll talk through this stuff. I had a retired Washington University professor come in this morning, and he's such a terrific guy. It's his second trip in, and he's just that guy. And he's always got his notepad, and he's taking good notes, and he's pondering and thinking through all of this. And I know where he's going, but he's going to have to kind of stop and, sniff the flowers and walk his path along the way because he's such a deliberate guy, and I love that. So anytime you need help on this, please reach out. And I do invite folks, once we get together and we start talking about this stuff, that cell phone number there, I always invite folks to send me texts. If you get kind of deep in the process and you're in trouble and you have a question, take a picture of the Social Security page you're on and text it to me. We can always help you through this stuff.
Kevin, are you at the same office as Paul across Maryville Center? Okay. So
I
for
am
those
indeed.
of us at the hub, Kevin's very close, whether he, like you said, comes over or you want to just take a field trip over, he's right across the highway is where his office
That's exactly
is.
right. It's a great area. Just be careful with the traffic. But yeah, I'm there all the time. We can always get together, folks, anytime you need. Nope, all baked in. It's pretty amazing. I can answer for health savings accounts. I don't know, Joyce. I might defer to you on the flex
Yeah,
spending
I'm
account.
going to have to look that up. I more commonly hear it with HSAs as well. Let me check on that, and I will get back to everybody on that definite answer.
And here's why, for perspective. Most folks, especially if you're with ESSA Health, most folks are going to remain on the employer plan if you have that flex spending account. It's only when you're coming off that and coming to Medicare, that's where the HSA does come in. And I do know, folks, if you're contributing, and Joyce, we have a health savings account, don't we?
We do.
That's it, which is creditable. The dollars you're putting in there, folks, I cannot say enough good things about HSAs. That's an untaxed dollar forever for medical related expenses. You can pay your Part B and D premiums. More important, forget the premiums. Those are pretty small relative to exposures. Your out-of-pocket costs, things like doctor copays on an MA plan or that deductible with a Medigap plan. The big one, prescription drugs. Beyond that, eyeglasses, contact lenses, dental work. You can use those HSA dollars forever. So continue to contribute to that HSA as long as you can. I'm going to pause for a moment here. I'm not going to go deep on this. But know that this generates a lot of phone calls. If you are contributing to a health savings account, don't take Medicare, any part of Medicare, until you need it. And here's why. If you go enroll, you're still actively at work with ESSA and you turn 65, you go enroll in premium-free Part A hospital, figuring, well, I get the card. It gets me halfway there. I can go take B down the road. You can no longer contribute to that HSA. If you need guides on that, I have some great guides from United Healthcare Optum and from the IRS. I can send you information on that. But if you do that, you're eliminating your ability to contribute to the HSA. I'm going to go one step further here, but no further. If you enroll in Medicare after 65, let's pick an age, 67, you're going to tell Medicare and Social Security when to start Part B, the part with a cost. You're going to do that through the forms, the enrollment forms. They're going to go backwards 6 months to make Part A effective. So your warning, folks, is quit contributing to that HSA 6 months prior to taking Medicare if you're going to take Medicare over age 65. If you're 65, you're fine. Contribute right up to it. If what I just said is clear as mud because we're 50 minutes into this and you're tired, call me. Guides, information, resources, perspective. I'm glad to share it because we want to keep you out of trouble on that one. And I note here, the trouble isn't big, folks. It's a little bit of, it's tax form and a few bucks in taxes if you get it wrong. But let's help you with the timing on that. Please reach out when you need on that.
And as Kevin mentioned at the beginning, if you hopped on a few minutes late, he is a salaried team member through our broker MMA. So he's available to all of us at no cost. If you meet with Kevin, there's no cost to you as being a part of ESSA Health or Navis.
And you guys already figured out I'm a nerd. I love this stuff. Again, I've done it for 31 years. Anything I can help you with on this, please reach out. And the reminder is, if you've seen it once, I may have seen it 50 times. So reach out.